Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to improve patient care and transform healthcare. This is episode 7 of our 10-part series on case management, and today, we are focusing on the patient experience. We often hear about patient-centered care, but are we truly delivering it? Too many patients leave the hospital feeling confused, unsupported, and unsure of what comes next. They deserve better. They deserve a healthcare system that sees them as individuals, not just cases. The good news? Case management can be the bridge that transforms patient care. It is the missing link that ensures continuity, support, and communication, giving patients the confidence and resources they need to take control of their health. In today's episode, our hosts, James Carter, BSN, RN, an ICU nurse, and Emily Ramirez, MSN, RN, a nurse manager, will explore how case management can dramatically improve patient experience by ensuring continuity of care. The importance of understanding a patient's holistic needs for better long-term outcomes. How effective case management empowers patients and enhances communication between providers and caregivers. Simple but impactful ways nurses can elevate patient-centered care. They will also discuss insights from Dr. Nicholas Abella's article, highlighting how nurses can lead in improving patient experience through case management. And as always, we will leave you with an actionable takeaway: develop guidelines for bedside nurses to follow up with patients after discharge, ensuring that every patient receives the support they need beyond the hospital doors. Patients are asking for better care. It is time to answer that call. Let's explore how case management can be the solution.
Welcome back to the Healthcare Nurses Network podcast. We are here to, give you the tools and the knowledge to provide that exceptional patient care. And today we're going to take a deep dive into case management.
Oh, exciting.
And trust me, this isn't like just another buzzword,
Yeah.
right?
Right.
We're going to unpack how it can really transform your patient's whole experience.
Yeah,
And even make your job, maybe a little bit easier
for sure.
and improve outcomes overall for everybody.
Yeah, I think often in healthcare, we get so focused on like the medical tasks, the things that are right in front of us,
Right.
that we forget about the person behind the diagnosis,
Yeah, it's so true.
Yeah.
It's like, one of the sources even pointed out, we can treat patients like a collection of symptoms
Exactly.
rather than like a whole individual.
Yeah,
Right.
You're not a disease.
Yeah,
You're a person, right?
exactly.
And case management really flips that whole script.
Yes.
And it's about seeing that whole person
Oh.
and not just the illness, but the whole person.
Absolutely. Okay, so let's paint a picture.
Mhm.
Imagine a patient. Maybe they have a complex diagnosis, right?
Yep.
And they're being discharged.
Yeah.
And they're probably feeling overwhelmed.
Oh, yeah.
They're unsure of what's next. What happens now?
Absolutely. And I think that's where even like little case management strategies can have such a huge impact. So if you think about that same patient receiving a follow-up call
Oh, wow.
from their nurse
Okay.
a couple days after discharge,
Yeah.
and it's just a simple check-in, how are you doing?
Yeah.
Do you have any questions?
Oh, yeah.
Addressing any concerns. There was a study published in the Journal of Nursing Administration that found that this type of follow-up can reduce readmission
Wow.
by as much as 25%. So if you think about that impact,
That's a game changer.
that is huge.
Yes.
Yeah.
Okay. So what are some other tangible ways nurses can incorporate case management just in their daily practice?
Well, I think providing patients with a really clear written summary of their care plan is crucial.
Okay.
Because can you imagine trying to remember everything
Yeah.
from your discharge instructions?
Oh my gosh.
Like, here are your meds, here are your appointments, here's what you need to change in your life. It's a lot.
So much, especially if you're not feeling your best to begin with.
Exactly.
Yeah,
You're overwhelmed.
totally.
So that written care plan with contact information for any questions can be such a lifeline. It empowers the patient to take control of their recovery.
Okay.
It reduces their anxiety.
I am already thinking about how I can implement this with my patients.
Yes.
Okay. So this brings up a question. What if my hospital doesn't have a designated case manager?
Yeah.
Does that mean we can't use any of these strategies?
Absolutely not. Case management is it's more than just a job title.
Right.
It's a way of thinking. It's this patient-centered approach that every nurse can use.
So even without a dedicated case manager on staff,
Yeah.
you can still be proactive.
You can. Think about collaborating with social workers, connecting patients with community providers, involving family members. It's about building that support system around your patient.
I love that. It takes a village, right?
Yes, it does.
And our source material even suggested, like, creating a checklist for patients and their families.
Yeah.
That outlines the follow-up appointments
Yeah.
and, like, helpful community resources.
Yeah,
It's like handing them a roadmap to recovery.
exactly. And that's the beauty of case management is you can adapt it to your patient population, your resources, your setting.
So it's like whether you're in a large hospital or a small clinic, there's always a way to weave those principles of continuity,
Yes.
individualization, empowerment
Yes.
into your care.
Exactly. And remember, you don't have to do everything at once.
Yeah, baby steps.
Pick a patient, pick a strategy, pick one thing
Yeah,
and make a difference.
right. Maybe it's those follow-up calls. Maybe it's the written care plans. Maybe it's partnering with social work to connect patients with community resources.
Exactly.
Yeah,
And those small steps lead to those big changes,
that's right.
not only for your patients, but for you as a nurse.
I love it. Okay, so let's shift gears a little bit and talk about how nurse leaders can play a key role in creating this culture of case management within their teams.
So I think one of the most important things they can do is develop clear guidelines for those bedside nurses on how to incorporate those principles into their everyday routine.
Okay, so give us an example. What does that look like in practice?
Yeah, so it can be as simple as implementing a standardized form for documenting those follow-up calls or establishing a system for flagging patients who might need more support.
Right, so it's like providing structure and support
Exactly.
so that nurses feel empowered to go that extra mile.
Yes, exactly. And don't forget about measuring success. Are those calls reducing readmissions?
Oh, right. Data.
Data. Are those care plans improving patient satisfaction? We need to track that data to make sure our efforts are making a difference.
Great point. It's not enough to just implement these strategies. You have to evaluate effectiveness.
Yes.
Make adjustments as needed.
Exactly. And that's how you create that culture of continuous improvement.
Yes.
Not only in your practice, but in healthcare as a whole.
Oh, I love that. Okay. So it sounds like case management is really about bringing together the best of both worlds. You're providing top-notch clinical care, but you're also making sure that your patients feel seen,
Yes.
heard, supported.
Exactly. It's about recognizing that healthcare is more than just treating those symptoms. It's about caring for the human.
Absolutely.
Yeah.
Now, I know some of you might be thinking, okay, this all sounds great in theory, but realistically, we're already so stretched thin. How are we supposed to find the time for all of this? And that's a valid concern.
You're right. It's all about finding those small, efficient ways to integrate it into your workflow.
Absolutely. Let's address some common objections. For example, what about the argument that patients won't remember everything we tell them at discharge?
And that's why that written care plan is crucial,
Right.
because it gives them something to refer back to,
That's
something tangible they can use to navigate their recovery.
Right. Okay, what about the concern that we just don't have time for follow-up calls?
And again, think of it as an investment. Those calls might take a few minutes of your time, but they can potentially prevent a readmission, which will save everyone time, resources, and stress in the long run.
You're so right. So it's not about adding more to our plate. It's about working smarter,
Exactly.
not harder.
And remember, you don't have to go it alone.
That's right.
Reach out to your colleagues, supervisors, your professional organizations.
Yes.
There's a wealth of knowledge and support out there.
And speaking of support, I have to give a shout out to our incredible Nurses Link Up app. It is available on both Apple App Store and Google Play Store. And it is such a great way for nurses to just connect,
Yeah.
share best practices,
Yeah.
access resources
Yeah.
on a wide range of topics, including case management.
It's a game changer for nurses who are looking to just stay connected, stay up to date
Yes.
on what's happening.
Absolutely. So if you're feeling inspired to dive deeper into case management, be sure to check out the Nurses Link Up app and our website
Yes.
at healthcarenurses.net,
Yes.
where you will find, a treasure trove of information and resources.
Absolutely. We've talked a lot about the practical side of case management, but I think we should also acknowledge the emotional impact, too.
Oh, absolutely. It's about so much more than just like checklists and care plans,
Yeah. It's about human connection.
Yeah.
Think about it from the patient side. They're often feeling vulnerable,
Yeah.
scared, uncertain about the future.
Especially when they're facing, a really complex diagnosis or like a really challenging recovery.
Yeah. Absolutely. And that's where case management can really make a huge difference. That follow-up call,
Yeah.
that handwritten note on their care plan, that extra time that you take to really listen to them, it shows them that they're not alone,
Right.
that someone cares.
It's about bringing compassion back into healthcare.
Exactly. And that compassion, that human connection, it has this ripple effect. It not only benefits the patient, but it also enriches your experience as a nurse.
I couldn't agree more. It's those moments of genuine connection that really make our work so rewarding.
Absolutely. And let's not forget that case management can also be a really powerful tool for addressing health disparities.
That's a great point.
Mm,
We know that certain populations face significant barriers to access quality healthcare.
And case management can really help bridge those gaps by connecting patients with resources,
Right.
advocating for their needs, and providing that culturally sensitive care.
It's about ensuring that everyone, regardless of background or circumstance, has the opportunity to achieve optimal health.
Exactly. Now, I want to address a common misconception about case management. Some people see it as like an extra burden on nurses,
Yeah.
something that takes away from their already demanding workload.
Right. I can definitely see how some nurses might feel that way,
Yeah.
especially when they're already feeling so stretched thin.
Right. But I would argue that case management actually makes our jobs easier in the long run.
Okay, explain that one to me.
So think about it. When patients feel supported and empowered, they're more likely to adhere to their treatment plans,
Okay.
to manage their conditions effectively, and avoid those unnecessary hospital visits.
Which ultimately reduces our workload
Yeah.
and allows us to focus on, providing the best possible care to those who really need it.
Exactly. It's a win-win for everyone.
I love how case management really emphasizes that proactive side of nursing.
Yes. It's about anticipating needs, identifying potential challenges, and intervening early to prevent complications.
It's like we're playing offense instead of defense,
Yes.
which is a much more empowering way to practice.
I love that analogy. And it brings us back to a key point we discussed earlier, the importance of data.
Yes, we need to be tracking our progress, measuring our success, and using that information to refine our approach.
Are those follow-up calls actually leading to fewer readmissions? Are those written care plans improving patient satisfaction?
We need to have those answers so we can really demonstrate the value of case management and advocate for its continued implementation.
Exactly. And that data can also help us identify areas where we need to make changes or explore new strategies.
It's about continuous learning and improvement, not just for ourselves, but for the healthcare system as a whole.
Absolutely. And that's what makes case management so exciting. It's not a static concept. It's a dynamic approach that is always evolving to meet the changing needs of our patients and the healthcare landscape.
I think it's safe to say that case management is here to stay.
Yes.
And for good reason. It aligns perfectly with that movement towards patient-centered care.
Yeah.
And it really empowers nurses to truly make a difference in the lives of their patients.
And speaking of making a difference, I wanted to circle back to something we talked about earlier, the importance of self-care.
Ah, yes. The often forgotten but absolutely essential aspect of nursing.
Case management can be emotionally demanding work. You're dealing with people's lives, their fears, their vulnerabilities.
Yeah, it's really easy to get caught up in the intensity of it all
Yeah,
and forget to take care of ourselves.
exactly. And it's so important that we prioritize our own well-being,
Yes.
both for our own sake and for our patients.
Absolutely.
Yeah.
If we're burnt out and stressed and emotionally depleted, we can't provide the best possible care to others.
Exactly. So make sure you're taking time for yourself, whether that's getting enough sleep, exercising, spending time with loved ones, or doing something you really enjoy.
One of the things I love about the Nurses Link Up app is that it's not just a resource for professional development.
Right.
It's also a space for nurses to just connect with each other,
Yes.
share their experiences, and offer support.
Absolutely. It's a virtual community where nurses can feel seen, heard, and understood.
And that sense of community is so important,
Yes.
especially in a profession that can be as demanding as nursing.
Absolutely. So if you're feeling overwhelmed or isolated or burnt out, reach out to your colleagues, your supervisors, or connect with other nurses through the Nurses Link Up app.
Yes,
Remember, you are not alone in this. We're all in this together.
that's right. And speaking of resources, I want to remind everyone about all the amazing information on the Healthcare Nurses Network website.
Yes. Head over to healthcarenurses.net to find articles, webinars, and all kinds of tools to help you implement case management principles into your practice.
We are committed to providing you with the knowledge and the resources that you need to thrive as a nurse and provide exceptional patient care. So as we wrap up our deep dive into case management, I want to leave you with this thought.
Imagine a healthcare system where patients aren't, just receiving medical treatment, but are really cared for as individuals.
Where they feel empowered
Yes.
to participate in their healthcare journey
Yes.
and leave the hospital, feeling confident and prepared for what comes next.
That's the vision of case management.
Yes.
It shifts the focus from just treating illnesses to nurturing, that well-being.
And it reminds us that as nurses, we have this incredible opportunity to make a real impact on our patients' lives.
I love that you said opportunity because case management isn't a burden. It's a chance to practice nursing in a way that's both fulfilling and effective.
Yeah, it's about reclaiming that human connection that can sometimes get lost in the, everyday hustle and bustle of healthcare.
Absolutely. So as we wrap up this deep dive, I want to challenge you all to think about one small step that you can take to incorporate case management principles into your own practice.
Maybe it's committing to making those follow-up calls.
Yeah.
Or partnering with a social worker to connect patients with community resources.
Or maybe it's just taking a few extra minutes to sit with a patient, truly listen to their concerns, and make them feel heard.
Yeah, all great points. Remember, every small step creates a ripple effect,
It does.
leading to a more compassionate and patient-centered healthcare system.
And for those of you who are eager to learn more and connect with other nurses who are passionate about case management.
Yes, don't forget to check out the Nurses Link Up app. It's available on both the Apple App Store and Google Play Store.
It's a fantastic resource for staying connected, sharing best practices, and accessing valuable information.
And of course, you can always find a wealth of information on our website, healthcarenurses.net.
We're committed to supporting you on your journey to providing exceptional patient care.
Thank you for listening to the Healthcare Nurses Network podcast.